My name is Steve Trocha, and I am a surgical oncologist working at Prisma Health. I originally grew up in Northern California in Sonoma, which is the wine country. And when I left there, it was really to go off for my medical school education. I went to the Medical College of Wisconsin. Some people might know that as Marquette University. And then after medical school, I did my residency at LSU down in Shreveport, Louisiana. It was during my time at Shreveport that I really found my love and interest in surgical oncology. And from there, I applied for a fellowship. And after general surgery, I went to Santa Monica, California, which is where the John Wayne Cancer Institute is. Did my time there, had an incredible experience. And from there, I was hired to here. Surgical oncology is a very broad field, and it depends on where you go, and even within an institution, who you might see. Surgical oncology, by definition, means cancer surgery. So that means any cancer anywhere in the body. But clearly, I'm not a brain surgeon. I'm also not necessarily a thoracic surgeon. There are specialists in those fields. I tend to focus on the skin, so melanoma, Merkel cell, other skin cancers that are too big, like squamous cells and basal cells. I also focus on sarcomas, which are what are called soft tissue cancers. Oftentimes people have those on their legs or their arms. And then everything pretty much in the belly. So that would mean your stomach, your pancreas, your liver, your small bowel, any of those kinds of structures would be cancers, if they have them, that I would be asked to take care of. Surgical oncology was not actually my first love, believe it or not. I actually still have a newspaper clipping from when I graduated from high school where I got a scholarship from the American Heart Association where I said I wanted to be a cardiothoracic surgeon of all things. Time goes on and you start to learn new things. Ultimately, when I was in medical school, I was very enamored with transplant surgery of all things. Transplant surgery is fascinating and it is an amazing discipline. However, the lifestyle is pretty brutal and it is hard. And so it was probably in the middle of my surgical residency that we had a new attending join us at our institution who was a surgical oncologist. He was not only dynamic, he was a great teacher, a brilliant surgeon, and loved doing research. And it slowly dawned on me that those were some of the things I really enjoyed. I love long-term relationships with patients, I love doing research, and I love teaching. You know, when you take care of patients, it's not only just taking care of the patient, it's also, in other words, taking care of their particular cancer. It's trying to give them some information about what their cancer is, maybe how it came about, where it came from, what they can do to maybe continue to improve their lives after they have surgery, for instance. So to me, it's not about giving a patient a diagnosis. It's about trying to explain to them what the diagnosis is, where it comes from, who has those diagnoses, and once you've had it treated, how do you potentially keep it away? Whether that be through exercise, whether that be through diet, whether that be with meditation, whatever things could potentially fit your particular lifestyle are things that I help patients focus on. Now, of course, we take care of the cancer first and foremost, but that is really only one small piece of a much bigger puzzle in a patient's life. And so when we're inspiring health, we're trying to go beyond just the diagnosis. You know, when I was a younger man, I had a lot of hobbies. And then I got married, and then I had kids. And then I didn't have hobbies anymore, because your kids are your hobby, essentially. And they're a long-term hobby. If you have kids, you know exactly what I'm talking about. Fortunately, my children have gotten older and moved out, and so I'm starting right now to relearn many of the hobbies that I've enjoyed. So for instance, I love fly fishing, and we live in a beautiful place for fly fishing, believe it or not. The Appalachian Mountains are the Blue Ridge Mountains are an absolutely beautiful place for fly fishing. I also enjoy motorcycle riding, which my wife and I both do independently and with each other, and of course traveling. So I have foreign parents, and my wife has foreign parents, and so we have an opportunity to travel overseas pretty regularly just to see family. And I think it's always been exciting for us to go see other places in the world, because at the end of the day, when I walk into a room to see a patient, I want to be able to have something in common to speak to them about. And I've been very fortunate to have traveled all over the world. And so when I walk into a patient's room, I feel pretty confident that I can put them at ease and also have something to talk about with them that isn't just their diagnosis. Because at the end of the day, they're going to become part of my family, and I think I'll be becoming part of theirs. If you would like to make an appointment with me and help you on your journey through cancer, please contact your primary care provider and ask for a referral.